Hi, good morning, everyone. I'm Dr. Nandini Gopalchandran, and I am the head of medical services and deputy director of Neurogym Brain and Spine Institute, Navi Mumbai, India. This is an institute which takes care of or deals with children and individuals with incurable neurological disorders. Not only do we treat these children, but we also look into the probabilities of why a neurological disorder is caused, such as autism. What are the changes that happen? How do we image? How do we have objective evidences to quantify the problem as well as see how the improvements or changes happen. So as far as the brain is concerned, we are doing a lot of work, and today I'm going to talk about autism. Autism is a condition where the problem is increased statistically. If we see the number of children which are being diagnosed with autism all over the world is increasing exponentially. However, the real cause of the problem as well as what happens in the brain is still a mystery. So today's webinar is basically our experience, Neurogen experience in trying to understand the brain of an autistic child and autistic individual using a special imaging technique known as a PET-CT scan of the brain. So today's topic is demystifying the autistic brain using PET-CT scan as a functional a tool to understand the functional abnormalities of autism. So today's webinar is going to be a bit technical. I'm going to try and simplify it as we go ahead. However, you may need to ask me questions later on, of course, but do try to pay as deep attention as possible. No distractions, please. Uh, So what is autism? We now do understand that it is a neurodevelopmental problem. This is very important. Earlier it was thought that it is a psychiatric disorder, but we know that as the brain develops, there is some abnormality which happens as compared to a normal brain. The development of the brain of a child with autism is different. It was first described by a psychiatrist because it was thought to be a neuropsychiatric condition at that time. Is diagnosed typically around 2.5, 3 years of life. It is a spectrum from mild to severe and diagnosed more in males than in females. That we do not know why, but a lot of other things we do know now. So what are the clinical features? Behaviorally, we see abnormal behavior in terms of social interaction being inappropriate, eye contact is limited, compulsive behaviors, so main problem one is social interaction, the other is communication. So even if the child is verbal, may not be able to communicate his needs, that is another issue. And cognitive problems, adaptability is an issue. So cognition, behavior, social interaction, and sensitivity towards others' emotions is limited or less. So these are various issues that a child or an individual with autism can have. And a lot of parents, everybody wonders why my child, what happened to my child. We may not have the exact answer, but we can try and understand why it happens. So let's look at the possible causes. Genetics has emerged as one of the most likely causes, but it is one aspect of autism. Genetics is not whole and soul. A genetic predisposition or heritability is seen in many children, in many families, but environmental factors also have an equal role in manifestation of autism. So it is a combination of two or more factors which leads to the manifestation of autism. The genetic involvement has been studied to a great extent. For example, in siblings or twins who have autism, as well as in family when we see heritability. So there is a lot of association seen with various genetic defects. However, environmental factors, as I said, play a lot of role in converting these genetic defects into the symptoms of autism. So one of the major causes has been seen prenatal and antenatal causes. So a mother's condition when she becomes pregnant, her lifestyle, her nutrition, stress during pregnancy, depression, medications that the mother has taken, as well as the child is born, if there is any hypoxia during or after the birth. The other causes such as vaccines or intestinal dysfunction these are things which are being discussed. The vaccine theory has been refuted, and that's why I would like to talk a little bit more about why the vaccine theory is not so important, though has been discussed elsewhere. What we do see is that we can detect the problem as early as 6 months, and hence the vaccine theory becomes a bit obsolete. Anyway, intestinal dysfunction adds to the manifestation of this condition, though may not be the primary cause of autism. Um, so, when we look at the pathophysiology of autism, what exactly is happening in the brain or the body of a child with autism? There are a whole lot of theories, systemic theories, I call them. So, there could be a mitochondrial dysfunction in the brain or in the whole body, inflammation in the brain, inflammation in the gut could also increase the problem in autism, oxidative stress leading to damage in the brain, dysregulation of neurotransmitters, yes, imbalance in the GABAergic, that is the inhibitory neurotransmitter, and glutamate, which is the excitatory neurotransmitter. The imbalance in this may lead to autism or cause a few features of autism. Hormonal imbalance later in the life of an individual or a boy or a child. The increase in the severity of autism is attributed to hormonal changes, immune dysregulation, and environmental toxins and stresses definitely have a major role. But these are systemic causes. Now, what we do all agree to a certain extent, the neurodevelopmental, the development of the brain is affected. But what? What in the brain is affected? When we do what we routinely know is an MRI scan of the brain, we find the structure is normal. So when you look at a three-dimensional picture of the brain, you may see that all these structures here are normal in an individual with autism. This is a regular MRI which is done at a diagnostic setup. Just so I'm not talking about the research. When you look at what is known as cortical and subcortical structure, that means the outer and the inner structures deep inside, the structure appears normal. Okay, so what are we trying? Now we see the structurally the brain is normal. So what is wrong? So what is wrong is the brain circuitry, the connections of one part of the brain with the other, the function of the neurons, and the wiring of the brain is affected. So let us a very simple example to understand for parents to understand. When you look at the illustration here of a typical brain, you can see 3 points in the brain. You can see A, B, and C. So when there is, for every action, there is a very complex connection or connectivity which gets triggered to for appropriate action to take place. So in that case, an input goes from A to B, and then from B to C, and from C to A, and this completes the circuit. This happens in a typical brain. However, look at the contrast in an autistic brain. Though you do see input from B to A or A to B, we also see aberrant or abnormal inputs from other parts of the brain coming to these 3 points. So apart from the regular information, unnecessary information is being passed on to that part of the brain which needs to get activated for a particular action. That means that the sensory information which is received and the processing that happens gets completely haywire. So aberrant or abnormal connectivity or abnormal information coming from other parts tends to jumble up the thought processes in the brain in the child's brain, and hence the output gets affected. For example, when you go to a gathering where there are a whole lot of people, many for us, when we are talking to a particular person, we are concentrating and we try to submerge or ignore the other information which is coming in so that we can pay attention to that particular person whom we are speaking to. However, many a times we are not able to do so and we get distracted by other information coming from the surrounding. Similarly, in a child with autism, every situation feels like he or she is in a crowded place, and whatever information is coming through becomes multiplied, and that distracts the child from giving a output. So there is overload sometimes, and sometimes there is very little information coming in. So what we see in a brain with autism is an imbalance, and that's what we are going to more and more understand today. So there are various theories what happens in the mind. Just to give you a little bit of an understanding of this theory, the theory of mind. The theory of mind says that a person's ability to understand other people's other people and what other people are saying is developed in an individual. For example, person's ability to understand the subjective mental state of others. So empathy, why a person is crying and why a person is laughing. To be able to respond, we need to understand other people's emotions. However, in an individual with autism or in the autism spectrum, this processing is underdeveloped. So the empathy or understanding of others and thereby responding in a social situation is limited or less. And the brain structure involved here, as you can see, this is a prefrontal cortex and the cuneus. So precuneus, these are the areas which are functioning abnormally in the brain of an individual with autism. This is what the theory of mind puts forth. This is one theory. The other theory is the mirror neuron system. When a child is born, the child takes information from the surrounding, sees what others are doing, and learns from it. However, in an individual with autism, this function is affected, and individuals or children with autism are not able to learn or extract information from the surrounding, like imitation skills or learning from the surrounding, responding to the surroundings, and sensory processing. That's why we say is affected. Again, the brain areas involved here is the premotor cortex. So this is a dysfunction because of which leads to lack of social interaction, and cognitive or learning from the surrounding is affected. The third theory is the dysregulation or imbalance between excitation and inhibition. When we say that we have to have a status where when we are responding to external stimulation, a balance in us. So people who are well balanced are able to respond or adapt to stresses better. In an individual with autism, this balance at the synapses where information processing happens in the brain is abnormal. So you can see here that this is a synapse. What is a synapse? One neuron comes and gives information to another neuron. This is the synaptic junction where information processing is happening. In our brain, there are two types of major synapses. One is a excitatory synapse, that is, which releases glutamate as a neurotransmitter. The another is an inhibitory synapse known as GABA or gamma aminobutyric acid. So the balance between these finally gives rise to a normal sensory and cognitive network. So the circuit is proper if these two neurotransmitters are working properly. However, again, in individual with autism, either the glutamate is very high, so the individual is too excitatory, or the GABA is too high. So that means inhibition is more. So this imbalance again could be responsible for the manifestation of autism. The fourth theory is theory of impeded plasticity. So let us understand what plasticity is. Plasticity is a phenomena in which the brain has the potential to adapt to various injuries. The general understanding for a long time was that once the brain is damaged, it cannot regenerate or repair, or loss of function cannot be regained. However, there have been instances all over where we do see that even if there is a brain damage, the brain, if stimulated, if rehabilitated, if given the right guidance, is able to regain some of the function which is lost, and that is known as plasticity. So one part of the brain takes over the function of the damaged part, whereby returning the function which is lost. As the brain develops prenatally, before the child is born, after the child is born, and as the child grows, there is a lot of change in the brain matter, the brain volume, the neurons which are multiplying, the connections which are forming is constantly undergoing changes. When this flow of change gets disrupted, or there is a change, then there are neurodevelopmental problems. It is seen that in a child with autism, initially the neurons and the connectivity is too high, higher than the normal, and it does not follow the course of a neurotypical brain. So the structure is more, and then it suddenly goes down instead of the upway, which we have seen using PET scan, and there is a lot of evidence to that effect. So the normal development of the brain is affected, either it is too much or too less again in autism. So again there is an imbalance. So these were the old theories. A new theory which is coming forth is known as the default mode network. Now a lot of work is happening. We still do not understand this completely, but what is the normal default mode in you and me is that when we are awake and alert but not doing any activity, there is a default mode in our brain which is working and taking inputs from the surroundings. So we are sitting quietly, but we are alert. We are taking inputs from what's happening in our surrounding. But we are, when we are concentrating and working on a particular problem, or when I am, for example, talking to you, I am neglecting or ignoring my surrounding. So the default mode in a act when I am focused on a word is not functioning. Okay, so this is in a regular person or a neurotypical brain. However, in a child with autism or individual with autism, this default mode is hampered, or this default mode is not functioning normally. Either it is functioning less, or if it's functioning more, because the connectivity in the brain is either underdeveloped or overdeveloped. So the default mode in our brain is disrupted in autism, though more is being understood. So the area which is affected in such a brain is found to be the frontal gyrus, superior frontal gyrus here and here. So this is what the default mode theory says. Now these are various theories which are suggesting that different areas of the brain are affected. Now it becomes important to understand which areas of the brain. We saw that a regular MRI of the brain does not give us a lot of information. So we need to dig deeper, and we need to find a way to understand the functionality of the brain. So what options do we have? We do have functional neuroimaging, but right now for regular clinical purposes, functional neuroimaging is not very actively available for autism. Functional neuroimaging is available when a person is able to respond to the different instructions. Like we have seen a lot of functional imaging being done in stroke patients, in spinal cord injury patients, in high functioning autism, where the individual is able to respond to instructions. So functional neuroimaging or functional MRI is possible in very limited number of autistic children, and hence we are looking for other options. A very detailed analysis of functional neuroimaging done what is known as a resting MRI, where the children do not need to respond to instructions, was done for children at risk at the age of 6 months. So if there is a in a family, if there is one autistic child, another autistic child is also susceptible to autism. Those children were taken up. About 59 of these children, the brain was imaged, and it was predicted which of these children could be susceptible to for autism, reassessed at 24 and found to be autistic. So that means that changes which happen in the brain can be detected as early as 6 months, and hence the theories that vaccines at 1.5 or 2.5 years age are the cause for autism again, becomes defunct, because the changes in the brain can be detected as early as 6 months. Though still this is more research, but this has been found, and that's why we need to understand that again autism is a neurodevelopmental problem. So let's look at the brain for a while. Now this is the brain where you are seeing the brain from the side. Okay. Now this is the front of the brain, the prefrontal cortex, for which I will be talking more detail about. The premotor cortex, the Broca's area for speech, motor cortex. This is the parietal cortex. This is the area for vision. Again, this is the cerebellum. It's important for you to remember this part. Okay, and this is the pons and the medulla. Now let us look at which areas of the brain have been thought to be affected in autism. What we generally see is this part, the cerebellum, which is located in the back of the brain lower part, is important for fine-tuning of the motor activity, regulates the balance, body movements, coordination, muscles used for speaking, that is articulation or vocalization. So this is the cerebellum. The other area which you should look at is the hippocampus. You can see this thin structure here. The purple part is the hippocampus, though it's very small. It's very important for cognition, comprehension, memory, retention of memory, and creation of new memory. The area below the hippocampus, that is this green part here, is the amygdala, responsible for emotional expression, social interaction, and aggressive behavior. Um, the basal ganglia here is important for the connection of these, the main brain, that is the cerebrum, to the cerebellum. So basal ganglia connects this. So affectation of this will also lead to an improper connection or execution of the functions of the main brain. So these are areas which are important for us at this point. So PET scan, this is just to give you a glimpse. I'm going to talk more in detail about the PET scan. The PET CT scan now, as opposed to MRI, gives us a functional or metabolic readout of the brain. You can see that this is a brain similar to what we saw here, is seen from the side, where you can see that this is the color spectrum made easy for you and me to read the PET scan. The green here is normal. As the metabolism of the brain, that is the functioning of the brain, becomes lesser, the light blue and the blue is low functioning, and as the blue becomes darker, the functioning is lower and lower. As the green becomes yellow, red, and white, it is hypermetabolism or more functioning. Okay, so you can see here the cerebellum and the deep area of the brain, that is the Hippocampus and the amygdala, also known as the mesial temporal, is functioning less, and a whole lot of the brain is functioning more. So this is the image that you will see in a PET scan. So what is a PET CT scan? So PET CT scan is known as positron emission tomography. This is what is basically done in this scan is a dye which is known as FDG. Just for simplicity, I'm going to let you know that G is glucose, F is fluorodeoxy. Now, fluorodeoxy is the tracer or the connector which will help us uh, understand where this glucose has reached. So the glucose is connected to the dye so that it can be picked up by the scan. Glucose is the sugar which is being used here for the brain to take it up. So glucose is one of the only sugar which the brain can use up for its own functioning. Once FDG is injected into the body through intravenous route, it remains in the body for only 110 minutes. That is the half-life. Half of this tracer gets becomes whatever tracer is injected becomes half in about 110 minutes. So the maximum that this tracer is in the body is for 4 hours. After that, you do not see any traces of this dye. So this dye, it measures the cerebral glucose metabolism. That means the glucose, how much of the glucose is taken up and it is used or remains in the brain cells is detected by this scan. And because it is taken up, that means that it also indicates the connection of the brain cells with each other. That is known as the synaptic activity. So metabolism, function and activity. To measure all of these, PET scan becomes a good tool. So as I said, the FDG or the dye is injected intravenously. It goes to the brain, it crosses the blood-brain barrier, and then it gets trapped into the brain cells, which is then measured. This is the machine in which the child or individual is then kept for the scan. The scan is about 15 minutes. It doesn't have a lot of noise as opposed to MRI, which is very noisy. The glucose metabolism is used to determine is picked up by the radioactivity in the brain is measured basically using a high resolution PET camera. The patient has to be fasting for 4 to 6 hours because the glucose level in the body have to be lesser than 150 milligram per deciliter. If the glucose is high, for example, if the child has had some food or individual who has some food, the glucose which is injected in the dye will not be taken up by the brain. Hence, the body has to be in a low glucose state. That's very important. Any diabetic who has uncontrolled diabetes, PET scan will be faulty. So it's important that the patient is in starving condition. The dye that is injected is very minuscule. It is 2.5 millicuvert. That means that the amount of dye which is injected is just enough to be taken up by the brain. It does not affect the body in a bad way because it's very minuscule amount. The scan or the cameras now which are used are very sensitive, hence the amount of dye which has to be injected is very low. So the worries of the parents that a lot of radiation, you can be not you can be rest assured that there is not going to be any long-term problem. Once the dye is injected, it takes up between 30 minutes to 1 hour, so broadly about 45 minutes for it to go into the brain and remain there. And a scan is done at around between 30 minutes to 1 hour, so we're going to take a mean of 45 minutes, and the patient is in supine or lying position and head is fixed with fixers, and then the brain scan is done. It takes about 15 minutes of acquisition for the brain scan. Then there are different frames or different sections of the brain are recorded or photographed, and the standard uptake value is calculated. So the standard uptake, so the brain basically is a three-dimensional structure. So each area is divided into voxels. That means a particular, that's the unit of the camera which it will record. So it will record at different points and then give us a mean or a three-dimensional mean average of a particular area of the brain. So this is the brain. You can see the different areas, they are picked up all throughout, and then the amount of radioactivity or the output is measured. So this is the CT scan of the brain. So it's a PET CT scanner. So CT is also taken. This is the transaxial. This is a PET. So this is the radioactivity which you can see here as black and white. But for naked eye to measure or to understand, the output is different, and hence it is fused. The CT and the PET is fused, and what you get is a output like this. Then this is a sample during analysis, the black and white that you see, and then the different color spectrum. So during the analysis, the colors are chosen, which spectrum of color we want to represent the different parts of the brain and their activity, and that is superimposed, and what you get is an output like this. So for a scan like this, you get an output like this. So you can see red, green, and blue. So these are different images. This image that you can see is the side view. Okay, so this is the side view. This you can see when the brain is cut like this, okay, is the coronal view. Okay, you can see the right and left side of the brain, and this here is when you cut the brain from top to bottom. So this is the axial. So this, so you get the brain representation in different views. Now, when you see a normal brain, this is how you will see. You can see the different sections. Most of it is green. You do see a little bit of yellow because the brain would be, if the person is awake and the brain activity is going on. But broadly, you see all of these areas are green. So this is a normal PET scan. Okay. In autism, which we will see area-wise, you can see the blue areas. This is the cingulate cortex. Here you can see the basal ganglia is functioning less. Okay. Here you can see the thalamus, the connectivity is less. Here you can see the blue, that is the medial temporal structure of hippocampus is low, and the cerebellum is low. So these are the areas which are blue, you can see are functioning lesser in different areas of the brain. Here again. So when you look at the brain, you are looking at the from up to down. These are the various sections, and as you see them, you can see different areas. So here you can see the connections, that is the cingulate, the center part. Okay, as you go down, here you see the thalamus. So thalamus is in small part. So thalamus is the connection between the two parts of the brain. So it is a small part here. So you will not see thalamus in all the sections. You will see thalamus here, 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 here. You can see the thalamus emerging. Okay, and then you see the cerebellum later. So cerebellum is in the, you can see cerebellum starts from here. So in the back parts, in the front you will not see cerebellum. You see cerebellum here later. Okay. So this is how you see different parts of the brain. You will not see all parts of the brain in all the sections. Okay. Here the cerebellum is emerging better. So this is the cerebellum. So these are the different sections of the brain. As you see, here is the mesial temporal. Okay. So in an adult brain, so we will see how the brain function. We did see how the brain functioning was in autism. We can see that autism, the functioning is less. So what has been studied and what has been shown in certain studies, as well as the study done by Neurogen, is that when you look at the brain of a neurotypical individual, you can see this blue line here. As the age increases, you can see the blue is increasing. In individual with ASD, initially the brain functioning is high. With it doesn't grow, it gets arrested, and you can see in later half it is coming down. I will show it much better in later examples. Now, very interestingly, in a adult brain, what you can see is that this is a brain of an individual who is an adult autism, and even in him you can see that the cerebellum is functioning lesser. Some you can see this area. So this is an adult ASD. So it's not only in a child but also later in the age when you do the scan, you see that the functioning is less. So let's understand a little bit about the circuitry of the brain. This is important. When you interpret PET scan, it is not straightforward. Okay, this area is functioning very little. So these are the only problems my child has. No, you have to understand that the brain is a circuit. It is a connection. So functioning of different areas will affect the other areas as well. So there are different pathways. So anterior cingulate cavus, you can see that if there is a connection, this is the anterior cingulate cortex, and you can see it is connected with different system. It is connected with motor system, that is activity execution. It is connected to the dopamine pathway, that is the motivation for an individual. It is also connected to the effort which is taken and motivation and approach. So not only activity but motivation to do activity. So we cannot say anterior cingulate cortex has only one function. It has one function but also connects to other. That means that if this area is functioning less, its low activity will affect other areas even though they look normal. I hope you got the point. We will look at other examples. Now we look at this area known as basal ganglia. The part of it, the smaller part of the basal ganglia is a caudate nucleus. You can see this is blue. Now what does the caudate function? The caudate is a part of this area known as globus pallidus. Now let us understand that 1, 2, 3, 4. This globus pallidus, this basal ganglia has caudate nucleus, globus pallidus, and putamen. It has 3 parts, and each are connected with each other. Caudate also gets inputs from the different parts of the brain. Okay, so this coordinates the activity of the main brain. So the main brain sends information to the caudate, and that again is connected to the other part of the basal ganglia, which in turn connects to the part here is the thalamus, this part. Okay, so there is a lot of interconnectivity, and thereby the functioning is not just the function of this particular part but its connection to the others. So this is the circuitry. So the brain is much more complex. The output or the manifestations in a particular individual is not just the sum of different activity but also interrelation. So the circuitry is very complex, and hence to simplify and say that because cerebellum is low functioning and the brain, the other part of brain is fine, it's only the coordination which is going to be affected. It affects much more than just the cerebellar function. I'm going to try and make this more easier as we go. This is to show you the complexity of the brain. Again, this area of the brain known as putamen, which is part of this complex here, the basal ganglia. Again, the low functioning of this area, you can see the complex, the connections that it has. It gets information from the main brain and then it gives information to the thalamus, which again sends information down to the spinal cord. So this connections, whenever there is an imbalance in the functioning of various area, the output is affected. Okay, so again here this is the thalamus which is affected. So if thalamus is affected, the information which has to be sent back to the cortex or to the spinal cord or the other part of the brain is affected. Mesial temporal, this we do say is the area for learning, understanding, social interaction, communication is affected. However, again, the hippocampus and the amygdala are connected to the other parts of the brain as well, affecting general output. The cerebellum, I generally call the cerebellum as a traffic police. So I say if you are at a crossroad and the traffic police or the signal at the crossroad is not functioning, then what will happen? There would be a chaos in the brain. So the cerebellum appears to be a small part, but it actually executes function of the whole of the brain. So when the functioning is low, so much will go wrong. So you can see here, this is the cerebellum. The cerebellum has connection with the cerebral cortex, with the spinal cord. Okay, it has with the midbrain, and it gives information to the spinal cord and back. So there is a back and forth here. Brainstem is a deep part of the brain, important for breathing and swallowing. Again, that is affected. So again, let us do a recap of different areas and brain functions which are affected and what happens in them. So this is thalamus. Thalamus is low functioning in many autistic children. It is important for sensory processing, for alertness, and for relaying of messages from the motor and sensory cortex to the from inputs and outputs from the spinal cord to the brain and back. Frontal cortex, front of the brain, is generally hyperactive. That means it is functioning too much. It could be responsible for the hyperactivity in a child, for overall understanding, emotional expression, problem solving, attention and concentration, awareness and judgment, social and sexual behavior, and language. So here this is sometimes over-functioning, and over-functioning is also not good. Here, basal ganglia, which we did see, is a island with multiple islands in it. Okay, controls voluntary movements, controls learning, repetitive behavior, eye movements, and cognition and emotion. Again, it connects this cortex to the cerebellum, if you remember. Anterior cingulate cortex, emotional formation and processing, learning and memory, an integral part of the limbic system. Medial temporal here is for memory, emotion, motivation, social interaction, danger awareness, and fear, as well as for learning, comprehension, and cognition. Cerebellum or cerebellar cortex. Cerebellum again is made of various parts. Here we are looking at the cerebellar cortex. Speech, that is articulation, eye contact, sitting tolerance. Also because the tone of the muscles is low, so the child is stooping and sitting and hence not able to concentrate, command following, attention span, and cognition. This is a paper that we have published, the baseline pattern and age-related developmental metabolic changes in brain of children with autism in the World Journal of Nuclear Medicine, where we studied the brain of children with autism and how the development is different. So this is a paper that was published by Neurogen Brain and Spine Institute. This is our own work, where we looked at metabolic pattern of healthy children, which was already published. So we compared what was published with what we saw in children with autism. So what we found that the metabolic pattern of brain in children is initially high between 0 to 6 years. Um, there is an increased metabolism seen in thalamus and in sensory motor cortex and in the cerebellum, and the other areas also of the brain. The increase between 2 to 6 months, and then the frontal cortex increases. So initially, temporal, parietal, and occipital lobe, that is, these areas increase first, and this part takes up information later. Okay. So, what is a pattern of growth? 0 to 6 years, the metabolic uptake or the functioning of the brain of a child is double that in adults. Between the 7 to 10, there is a steady increase, though not as much as the first 6 years. 11 to 15, the increase is slower, and 16 to 17, there is a steadiness, or it goes down and comes towards a normal level. This is the brain metabolism in a normal individual, with normal neurotypical child. 1 year, this was done from a child who did not have any neurological problem, but was PET scan was done for cancer. So we can see that this is a normal metabolism in the brain. This is for a 4-year-old child, and what we have published out of we have studied 45 individuals with ASD, diagnosed clinically, classified at different ages, and also compared with the CARS. We have not taken patients who had brain damage or brain tumor or structural problems. So this is a healthy brain which has already been published. So what is already published by Chugani et al. And Shan et al. Is that one set of scientists have shown that this is the age. You can see 0 to 16. So between 2 to 4, there is an increase in the brain metabolism. Then there is a steady up till 10 years, and then it goes down. Another set of uh, uh, scientists have shown that there's a steady increase in the brain function. Any which way, what we see that there is a increase at least from 0 to 10. Now let us see what happens in healthy versus autism. Okay. What we see in autism is this is a blue is less than 5, red is 5 to 10, and green is 10 to 15. So you can see different areas of the brain. Here you can see that in amygdala, you can see that the metabolism is going down with age. Caudate, down with age. Cerebellum, it goes down with age in autism. Hippocampus, the functioning goes down with age. Thalamus, it goes down with age. Superior temporal gyrus, down with age. Parahippocampus. So everywhere you can see that in autism, as the age increases, the metabolism goes down, as opposed to in a neurotypical brain or a normal brain, the metabolism goes up. So there is a complete dissociation. So just to simplify, blue is the metabolism of brain in a typically developing child. You can see from 0 to 5 or 6, there is a fast increase, then there is a steady increase. As opposed to that in autism, the metabolism is higher in a child with autism initially, and then it goes down. So that's the critical difference. So in healthy versus autism, we find that there is which I've already explained to you. So now when we look at where we see that, okay, there is a difference in normal versus autism. This has already been published by us. We have gone further and we wanted to see what is the difference in mild moderate versus severe autism. Though this is unpublished data, I'm just going to give you a glimpse of the difference. Okay, we have looked at about 134 individual, and a few key areas I'm just going to show you. Can you see this? Now the blue line here is mild to moderate autism, and the red line here is severe autism. What can you see? In mild to moderate autism, when you look at different ages, you do see that the metabolism is improving. While in severe autism, the metabolism initially may be a bit high, then it goes down, as opposed to autism in amygdala. This is the area. So severity increases. That's why the child who may be initially all right becomes more severe later. Hippocampus, area for learning and understanding, in mild to moderate, you can see an increase in the metabolism. In severe, again, it goes low, but it never goes. May go slightly up, but initially it goes down up till 12 to 14 years. Similarly, cerebellum, there is an increase here in mild to moderate, while in severe, initially high, then it goes down. So these are preliminary results that we have seen when you differentiate mild, moderate, and severe. Again, mild, moderate, increase, severe, goes down. Now, what we have found is that the CARS or the clinical assessment done by different individuals will give you different outputs, or it may not sync with each other. There is a difference of opinion clinically many times. But then when you correlate with the PET scan, you get a very good correlation. You are able to actually identify the severity of the condition using the PET scan. So the PET scan becomes now a more objective way of looking at what we see clinically. The same thing that I have shown you in the graph is shown in bar diagram here again. You can see that 2 to 5 years, this is mild to moderate, severe. Initially, you can see in severe, the functioning is slightly more in the 2 to 5 years in children with severe autism as compared to mild to moderate. But later, in 5 to 10 years, in severe autism, the metabolism or the brain function goes down. This is what I'm showing you. This is severe autism. In different areas, the functioning is going down. Again, in 10 to 15 years, this is mild to moderate, this is severe. Mild to moderate, severe. So every area you can see in severe autism, the gap is much higher. So the problem increases in a child with severe autism. So apart from diagnosing and knowing the severity of the problem, we can also use PET scan for prognostication to understand how the brain is developing after a certain intervention. So we have used PET scan in hundreds and almost thousands of children with autism and other neurodevelopmental disorders after doing stem cell therapy. So after doing the intervention of stem cell therapy, we wait for about 6 months to see changes in the brain. And I'm going to give you a couple of examples. You can see the brain here, a lot of blue, and this is after 6 months. You can see most of the areas have improved in functioning. This is 6 months after the stem cell therapy. So for prognostication, you can see improved glucose metabolism in parietal cortex. This is the parietal cortex. In the cerebellum, this is the cerebellum. Mesial temporal cortex, you can see here blue. This is improving, though not completely normal. Okay, and prefrontal cortex. Okay, here as well as thalamus. So all these areas have improved. The parietal cortex for processing of information, cerebellum for behavior, speech, eye contact, coordination, muscle tone, mesial temporal for social interaction and emotional expression and cognition and learning, prefrontal cortex for learning and for focus and concentration. So all these areas have improved in this individual. Now another example You can see here the cortex is all fine, but you can see the cerebellum is functioning partially and the mesial temporal again is affected. Okay, now you can see here the cerebellum improved and the mesial temporal has improved. In this section, we do not see the thalamus at all. So you can see improved in the cerebellum as well as the mesiotemporal structure. Another example, before the stem cell treatment, 6 months later, you can see cerebellum improving, the cortex improving, thalamus improving, mesial temporal improving. So this is how you have to match the sections and do the correlation. Improved brain metabolism due to improvement in basal ganglia and thalamus. Okay. Again, you can see the improvement. So this is about the PET scan. The other thing that you need to understand about PET scan is how it is interpreted. The general diagnostic centers will just give us the raw data. We have different softwares in which we will put this data and do the comparison, because it has to be done section wise under the same conditions. That's why it is important that it is interpreted by a specialist or someone who understands the brain function as well as the brain morphology. Now, this is a PET scan. As I told you earlier, if you remember, about neuroimaging, the imaging started with MRI, where broadly the MRI or the structure of the brain is reported as normal. But a lot of scientists and groups have looked at MRI much more deeper, dig more deeper, and there have been evidences which have come out, which have reported that the brain volume in children with initially in children with autism is higher. Now that's why apart from PET, at Neurogen Brain and Spine Institute, the research team is researching further into the volumetry of the brain, which has been reported as normal by radiologists, but we're looking much deeper into it to understand the volume and the connectivity. So if you remember, I said the connections are faulty. So the connection or the wiring in the brain, this is being done by our research team to understand the brain metabolism, brain functioning much more. So you have to understand the difference. The PET scan shows us what the neurons are doing, and the MRI shows us how big the area is, because the brain is a three-dimensional structure. The PET scan will not tell us the volume of the brain. So the volume of the brain will be understood by the MRI, and the connections, the connectivity, the wiring again will be better addressed with MRI. So both MRI and PET scan give us different information. So having done a lot of research on PET scan, which is still ongoing, we are now doing research on MRI as well. This is work in process. So this is just to give you an overview how this is done. Normally what you will see is this is a T1 weighted input. When you see a scan, this is what you will see. But in a specific software, the researcher goes in much deeper, looks strips of the skull, goes in more detail, looks at the white matter and looks at the atlas, puts it together and does these statistics, labels different parts of the brain using software processing, and we get the statistics. So this is a whole lot of hard work which is still going on, and hopefully keep an eye on this area, this webinar, this platform, and you will get more example. For example, we also looked at the connections or the corpus callosum. The corpus callosum is the part of the brain which connects the front of the brain to the back, connects one side of the brain to the other. So that is the connections, and basically does the wiring or the network information from the neurons going to each other and front and back. So that this here you can see, this is the corpus callosum or the bundle of fibers. So we are also looking at the connectivity of the brain in autism, how different this is. This is just a very beautiful picture to show you tractography, which is seen in a brain. So all these are fiber tracts which are normally not seen in a regular MRI. We need to look at the tractography. So this is the corpus callosum. So we are studying this at much more depth, and soon we will come forth with publication and information on the MRI and tractography. So this was about PET scan, and the further exciting information which will soon be available. Just wait for it. Thank you.